Hi everyone and welcome to another Psych Student video. Today we're continuing with the MCQ series where we're looking at a series of different psychiatry multiple choice questions to help identify areas of knowledge which are good and areas which may need a bit more help. So the first question, profound learning disability is diagnosed in someone with an IQ under A 10, B 20, C 30, D 40 or E 50. So IQ testing has been used as a way of quantifying the degree of learning disability experienced and has historically been put into categories including mild, moderate, severe and profound, and sometimes this is still asked about in exams. However, these categories are often criticised of being of limited practical use as individuals often have a variety of needs and skills and it can be really challenging to actually assess IQ formally. In this case, however, profound learning disability is diagnosed as someone with an IQ under 20. The most important thing, however, is to support the individual and to work to understand how they best communicate and what their own strengths and interests are, to be able to better understand what is and is not usual for that person and to be able to give them the best care going forwards. Question 2. Eye movement desensitization and reprocessing is a type of therapy often used in A. Post-traumatic stress disorder, B. Hypochondriasis, C. Generalized anxiety disorder, D. Somatization disorder, or E. Schizophrenia. So EMDR is a type of therapy aimed at helping people process traumatic experiences and feelings and is particularly helpful for those experiencing distressing flashbacks. So in this case, the answer is post-traumatic stress disorder, PTSD. Question 3. If a person is worried about multiple symptoms which appear unconnected, affect multiple body systems and appear to have no physical underlying cause, this is likely to be what type of anxiety disorder? A. Hypochondriasis, B. Conversion disorder, C. Generalized anxiety, D. Somatization, or E. Panic disorder. So as it stands in the ICD-10, the hypochondriasis disorders and somatization disorders are listed separately, although there are some overlapping features. It's also worth remembering that this might change with the introduction of the ICD-11 planned soon. In somatization disorder, there are multiple recurrent and sometimes changing physical symptoms, which are chronic in nature, and the person is often worried about the symptoms themselves, even when no physical explanation has been found after adequate investigation. It is important to check that you agree that there isn't a physical health explanation first, as some chronic pains, for example, can be challenging to identify the underlying cause of, and you don't want to be missing something that is underlying everything. To meet this diagnosis, there must be some degree of impairment in functioning as a result of the symptoms. Comparatively, in hypochondriacal disorders, the emphasis is less on the symptoms themselves and more on an anxiety that the symptom could represent a serious disease process, and there is often a worry about the specific diseases, for example, a specific type of cancer. They may continue to worry about this even when investigations for that illness have been normal. Conversion disorders, on the other hand, fit into the ICD-10 in the area of more dissociative presentations and often present more as a neurological disorder without evidence of underlying neurological illnesses such as functional changes in movement or sensory abilities. So overall, in this question, somatization is the best fit for the presentation described. Question 4. When commencing the antipsychotic clozapine, which is the most important blood test to monitor? A. Urea and electrolytes, B. C-reactive protein, C. Full blood count, D. Liver function tests, or E. Prolactin. So in clozapine therapy there are some rare but serious complications, and one is a drop in neutrophil count, which if it occurs does predispose the person to risks of serious infections and sepsis. So as a result, it's really important to monitor the full blood count regularly during treatment, and this takes place weekly initially on starting treatment. Other blood tests such as checking for renal and liver function are really important as they might affect metabolism and dosing, but they don't need to be monitored as frequently as the full blood count is. And lastly, question 5. Which of the following therapy types is most likely to be suitable for those with emotionally unstable personality disorders? A. Family therapy, B. Psychodynamic therapy, C. EMDR, D. Couples therapy, or E. Dialectical behavioural therapy. So these types of therapy could all potentially be very beneficial depending on the individual circumstances. However, the most commonly used therapy method for treating EUPD is DBT, which stands for dialectical behaviour therapy, and this is aimed at helping them to regulate emotions and manage stress. EUPD and personality disorders are also due a change in how these are categorised in the new ICD-11, so it'll be worth keeping an eye on that and how it might affect the treatment plans that we put in place. So overall, in summary, today we have covered some key diagnostic features and medication monitoring requirements. Going forward, it will be important to see how these features may be adapted and modernised in the new ICD-11 guidance due out soon. Thank you.